Good afternoon, everybody. It is Monday, February 8th, 2021, and this is your COVID-19 update for Special Areas 2 and the surrounding communities and our random audiences that also exist in other cities, usually family members of mine or of people who know me. I'm excited to say that right now we only have one case of COVID-19 disease that is active in our area. I do not know who this person is. I hope they are doing well and recovering at home because they are most definitely not in our hospital. We are all feeling well here at the clinic and we are fully open for all services both here and at the hospital. I've had a couple of concerns about what is the current policy up at our hospital and our nursing home for visiting. So our acute care, meaning patients in the inpatient ward of the Hanna Hospital, have one essential visitor who is allowed to come in and see them during as normal as we have visiting hours. If you are coming into the emergency department, you're allowed somebody with you, a single person for support. People like children are always going to be exceptions where there can be cases where they need to have 2 or more people accompany them. But where possible, please limit it to 1 person for the emergency department. The nursing home has recently opened to 2 essential visitors, meaning that 2 people are defined by the resident for visiting purposes. It was 1 for a period of time, and now we are up to 2. Yes, we are finished doing the vaccinations in the nursing home for those that wish to partake. They have received their 2 doses and they are more than 1 week past those 2 doses. They received the Moderna vaccine in the nursing home as per the Alberta Health Services Directive. That means that they are in general protected from severe illnesses and death due to COVID disease. However, the visiting policies have not been extended yet beyond 2 essential visitors. There are regular gatherings between the administration of the hospital and nursing home as well as the residents of the nursing home. And with the new variants that are circulating around Alberta, there's a little bit more caution because we are not confident on how the vaccine reacts yet with those new variants, both the South African variant and the UK variant. They have both been renamed. I do not know what the renamed is, so I'm going to continue to refer to them as the UK and the South African variant until I have a clearer understanding about what the rename will be. I suspect that in the coming weeks there will be more changes as long as the situation in the province improves, where people are allowed to have 3 of their children, 4 of their children, extended family such as friends and grandchildren coming to visit them in the nursing home. But for now, the policy is the 2 identified visitors. I believe each family was also sent a document relating to what is a low risk versus a high risk visitor. Please refer to that email document when you're making a decision of should I be going to the nursing home right now. For example, if I have recently gone to a gathering where there was lots of alcohol, no masks, I may want to think twice before I go into a nursing home setting where even with a vaccination, the residents are more vulnerable. On that note, I did receive another question that said to me that a couple is over the age of 75 in our community. They want to know when they can get their vaccine and how will they know when it's their turn. Right now, the answer is you cannot get it. There is no vaccination available to the general public over 75 or otherwise. They are still in stage or phase 1. The general population, beginning with those over the age of 75, is expected to start during phase 2. As you've heard in the news, we've had a lot of issues with supply of vaccines right now. And so there is a delay in getting to stage 2. Once us in the medical community receive notice that the people over the age of 75 in the community will be eligible, we will blanket it everywhere. It will come onto our Facebook page. I will announce it in this video. You will see advertisements in newspapers, on the nightly news, and around town saying this is where it is, this is how to get your appointments in order to be vaccinated. Even though there may be changes coming up in who is eligible when, I believe the general plan is to do age-based categories. So it's not your physician saying you are high risk, therefore you get a vaccine now. No, that creates a lot of administrative challenges. I anticipate it will be anyone who is born from this year or previous is now eligible. You may go and book your appointment. The understanding is that vaccine will be available in the communities. It's not expected that seniors are going to have to be driving themselves to Drumheller, Camrose, Red Deer, but we just don't know what the rollout plan is. So please stay tuned, and as soon as we know, we will let you know. I've had a few people asking me lately what I think about public gatherings and about what the government is doing with the current regulations. I know that today there was a number of things that opened up, such as in-house dining for restaurants, which is exciting and still difficult for many of us to grasp. How are we having some lifting and some more restrictive? So I think that it really reminds us that it's been a year that we've now been dealing with COVID-19 disease in our country. And the stuff that we announced to the public 11 months ago is very different from the stuff we're announcing now. What we've learned about this virus has changed dramatically. I know we used to say no masks, and now we say masks, and maybe it's airborne and masks don't make a difference. You see lots of things on the news. So what I would ask all of you to do is do your own self-assessment. And number one, wash your hands, right? I can't think of any public health initiative short of water treatment plants that have created more improvements in our health than remembering to wash our hands. Bring your alcohol sanitizer with you. When you go out in the public, when you go home, you wash your hands. You can use a sanitizer, you can use soap and water. It's a wonderful thing to keep us healthy. The other piece would be that if you are feeling sick, don't take a chance. If you have a sniffle and you're wondering, maybe I was just outside and it's not going away, don't go visit grandma, right? Just do what you can and use some common sense, and hopefully we all stay healthy for a great long while. Thank you for listening, and I will see you again soon.